some great wellness stuff for us to talk about. Bringing up number one sign of coronary calcification, according to cardiologists. Now, having just done all of my own coronary workups, I have first-person experience in all of this, which I want to share to help you to start getting ahead of the curve and heading off problems that could happen in years to come, and not having to be reactive to these problems, but rather taking the stance now of being proactive. So let's pull up the first portion of this article that I pulled up talking about coronary calcification. Let's go, bring it up. So let's open up this article, and we're going to talk. I only did all of this stuff myself, which is why I wanted to bring it up, because I think it's also very helpful. 805,000 people a year die in the U.S. from a heart attack, and largely it's due to increased calcification, plaque inside the arterial walls of the heart. So reading part of the opening of this article, one of the risk factors for experiencing a heart attack or getting heart disease is coronary artery calcification. And that's a buildup of calcium that occurs in the arteries. When it happens, the blood isn't able to flow through the vessels easily, and when the flow is blocked, it can lead to a heart attack. Let's go to the next slide. The number one sign of coronary calcification, it's tricky because it's tough to catch early unless you do like the calcium score, okay, again, which I just recently did, okay. When the vessels start to be blocked because of this buildup of plaque in the arterial walls of the heart, then you start having all of the symptoms that come with that. So according to this article, when this happens, Alexander Pastilian, I believe, Dr. Pastilian, says when this happens, it's common to experience chest pain during physical activity, and then that goes away when you stop exercising. Next slide. Shortness of breath, another symptom to be aware of. He also explains that there are additional signs of coronary calcification that occur in women, specifically saying women in particular can experience what we call atypical symptoms, which includes nausea, vomiting, and abdominal pain. I know this specifically because I have one of my clients who she was having pain in the on the right side of her abdominal. Okay, because typically you think of heart attack being radiating pain down the left arm, profuse sweating, nauseousness, shortness of breath, chest pain, sometimes for men's pain in their upper back. All sure signs that something is going wrong, absolutely. So we want to head these things off before you start having these symptoms, and the best way to do this is by doing the calcium score. All right, so why don't we take a nice little look at the heart here. Okay, there's obviously arteries that bring blood into the heart. It's not oxygenated. It's pumped into the lungs. The lungs put oxygen into the blood, comes back to the heart, bang, goes out, oxygenated blood to the body, where the body's going to use that oxygenated blood to obviously fuel our activities, things that we do, ambulation, all these things. So on the right side, the atrium is one of the four chambers of the heart. And the right atrium receives the blood that's low in oxygen. So the right side is getting this blood that's low in oxygen. It's taking it from the body, and empties the blood into the right ventricle. And then it goes on to the lungs. And then what we're going to get is then from the left atrium, the blood's going to come back to the heart by the pulmonary veins. It enters the left atrium. Left atrium, the blood's going to flow into the left ventricle, which is going to take that oxygenated blood that was received back from the lungs, pump it out to the aorta, and the aorta is going to distribute this oxygenated blood to all the parts of the body, and then the cycle is going to continue. So obviously, we want these arteries and these veins to be nice and wide, with good wide pipe without any of this obstruction, blockage, buildup of plaque. That's going to restrict blood supply, either coming in, that's low in oxygen, or it's going out, most importantly, which is rich in oxygen to the body, which needs this oxygenated blood. And the way we do that is by evaluating how good these pipes are, unobstructed, by doing the CT scan, the calcium score. All right, so let's talk about doing this calcium scan. It's a low dose, low cost. I paid $75, as a matter of fact, to do it. And they put you just through the donut, arms above your head. You go into the donut, zip, zip. It's 2 to 3 minutes, and what they're looking for is a scan of the chest. And the scan of the chest is allowing them to quantify the amount of calcium in the arteries that feed the heart muscle itself. And there's a lot of benefit to doing this because your calcium score should be 0, generally speaking. Basically, it says there's no plaque buildup inside of the arteries. If you start getting from 1 to 10, it's very minimum plaque buildup. Really, according, let's say, to my cardiologist, really nothing to be done. But, it's just a good sure sign of saying, okay, keep up the good exercise, keep up the good diet, don't eat foods that are hydrogenated fats or saturated fats, things that are going to contribute, fried foods, things like that. They're going to add and build up this plaque inside of the arterial walls, because as that calcium score starts to get higher, from 50 to 100, 100 to 300, above 500 to 1,000, now you really start having obstruction of blood moving through these arteries into the heart and out. And eventually what ends up happening is they have to stent you or bypass you. We want to avoid all these things. So we want to take care of this early. We want early intervention so we know whether or not we have to use statins, exercise, dietetic changes to kind of head off problems that could result from having this obstruction of plaque inside of the arterial walls. And so really, in short, you want to limit your exposure to coronary artery disease. These real simple tests and resolutions, pretty straightforward. Again, I just did them, which is why I'm sharing this information with you. You do the calcium score. Again, it's a CT scan, $75, $100, not expensive, gives you an idea of how much plaque buildup is inside of these arterial walls. Get a baseline EKG so that you know that whether or not you're having normal heart rhythm. Things can be seen inside of an EKG in that strip that says, there might be other things going on. You might even want to ask your cardiologist to do a Holter monitor where you wear an apparatus that is going to monitor your heart for 72 hours or so. And then other things can be seen in there, maybe things to watch. Again, baselining. I just did these things. Knowing your cholesterol levels. These things help so that you can intervene dietetically, making dietetic changes by increasing your exercise, reducing fat, hydrogenated oils, saturated fats, fried foods, simple carbohydrates, white flours, bleached flours. All these things start to contribute to coronary artery disease. And then one of the most important things is don't smoke. We know so much about smoking, and smoking is one of those things, again, that really, in fact, expedites all of these coronary diseases inside the heart. So definitely don't smoke. But get yourself to a cardiologist to do all these tests so that you can baseline yourself and find out whether or not you need intervention through some kind of a statin to control the amount of LDL cholesterol, this low density, this harmful cholesterol in your body. Change your exercise habits, move more, eat less. You know your calcium score, you can get an early intervention. Don't smoke and exercise. So simple, so simple. So get out there, go meet up with your cardiologist and find these things out. Get started early, because the earlier you get started, the earlier you can intervene, the better the potential outcome, so that you don't land on the dead list.